thank you, Dr. Bob Gill, for agreeing to come on to the talk about private insurance, health insurance system, and what it entails in this country. Now, I didn't really know anything about this till you alerted me to a story that's in the Times newspaper. I'll just show people this story, and I mean, it's pretty shocking. This guy here, this KC, you know, this lawyer, Bupa doubles premium of KC fighting cancer to £163,000. They increased the premium at a time when I was over a barrel. This is a quote that James Guthrie, the KC, had said. Now, what the story goes on to say is, after James Guthrie, KC, fell ill, he received a slither of comfort through the post when Bupa, his private medical insurers, sent a pamphlet entitled "Supporting You Through Cancer." At a time when you'll already have more than enough on your mind, we understand that the last thing you want to worry about is money, it read. Guthrie, 72, has been a customer for more than 20 years. Peace of mind he'd always made out his insurance, which also covers his wife, Lou, a calligrapher, he made sure his insurance was fully comprehensive and included cancer cover. Before he got cancer, he had been paying about £7,000 a year. Since getting bowel cancer in 2017, however, his premium has gone up and up. It almost doubled from about £42,000 in 2020 to almost £82,000 last year, a bill that arrived when he was seriously ill and receiving chemotherapy. Last month, a bill arrived for £163,639. This seems to miss the point of insurance, said Guthrie. Martin James, a consumer champion, said, there is an assumption health insurance is a little bit like a pension, that this kind of policy is front-loaded. They get all your money when you aren't making claims, and then when you reach your 60s and 70s and you need cover, they will pay out. This is a salutary reminder that that's not always the case. God, I didn't know that. And this quote here from James Daly of the consumer website Fairer Finance. He says that premiums that were reviewed every year allowed insurers to have their cake and eat it. Once you were sick and they know you were sick, they price you at a level that will make insurance unaffordable. I think that's the opposite of what insurance is meant to be, he said. It's absolutely not okay to price prohibitively because you don't want someone on your books. Now that's, I just couldn't believe it. I mean, you can't expect people to pay that kind of money for insurance when they're sick. I thought that, like they say in the quote, I mean, I thought insurance was a guarantee you wouldn't have to pay anything. Why doesn't anyone mention this stuff about it? Because everyone thinks they can just go and get insurance nowadays. Where does this whole thing come from? Is it a big scam?
Hi, Crispin. Well, there are many incorrect assumptions in most people's minds. First of all, insurance is there to make money. They make money by assessing individual risk on an annual basis. And unfortunately, when they see people are going to cost more than they bring in premiums, they start to price those people out of care. That is the hard truth about medical insurance. We know from America, rising healthcare costs are the biggest single cause of household bankruptcy. But we are living in, a bit of a sort of fairy tale assumptions about insurance being there because it's healthcare, that they will bend over backwards to cover our costs. But that is not why they're in business. So remember, they have to get in more in premium than they pay out for healthcare, and that's where the profit comes.
And you've looked at the American system, which is where this all comes from, effectively. This health insurance, and this is a video that you put out on your film about the NHS. I'm just going to play it.
The American healthcare system is made up of insurance companies, hospital provider chains, drug and medical appliance companies, and the government. The profit motive is the driving force, and for insurers, money can be made by the denial of care and high out-of-pocket expenses before insurance claims can be made. Hospital providers inflate charges and carry out unnecessary tests and treatments, then bill the patients, insurers, or the government. Drug and appliance manufacturers push up their prices, heavily market and exaggerate the benefits of their products. Some of those excluded by privatized healthcare are supported by government funding, Medicare for the elderly, and Medicaid for the poor and the young. But government funding mostly goes to private providers and insurers.
Yeah, so I mean, that effectively shows that everyone's making all those bits of the piece of the puzzle. They're making a fortune out of the NHS or out of healthcare. So can you tell us more about that?
Yeah, so you know what the American healthcare system is. It's the most privatized in the world. Amongst developed countries, it doesn't have universal cover. The system I'm describing there leaves out a lot of people who don't qualify for state funding provision and can't afford insurance, or the insurance doesn't come with their employment. So there are 30 million people not covered by any scheme, public or private. What that graphic tells us about is how the various interests, the insurers, the hospital provider chains, and the drug companies are all looking to maximize profit. That is their only concern. The patient is stuck in the middle. And if they happen to have treatment, operations, drug treatment, well, that's by the by. The fundamental rationale for that system is to maximize profit. What it wasn't said in the commentary to that passage, that graphic, was in every case, there's endemic fraud. Now, for insurance companies, they practice fraud by denying care. So you might be covered, but they'll say, well, you didn't tell us something in your claim form, so we're not going to pay out. So that's their way of cutting care and making more money. Whereas the hospital provider chains, they make money by overbilling and doing unnecessary tests on the poor patient, or giving them very expensive treatments they know full well will not help them. So you have a whole series of built-in perverse incentives to either fleece the private policyholder or to fleece the taxpayer through centrally funded healthcare provision. The American system is so perverse. I'll give you an example. President Joe Biden, when he was vice president, his son Beau Biden, who was a district attorney, had one of the best private health insurances money could buy. Unfortunately, he developed a cancer. The cancer relapsed. He developed a spread of cancer to his brain, and that started to affect his function. There were concerns it was affecting his speech, but it was revealing that when Joe Biden was interviewed about his son, he more or less said that he couldn't afford to give up work. Now, he didn't spell out why. I'll tell you the reason why. His medical insurance was linked to his employment. So he had to work until he close to death for fear of losing his insurance. So nobody is safe in that system. Now, what's happened to the NHS is effectively through legal change, we have reduced the NHS now to a logo and a funding stream akin to the American Medicare, Medicaid system, which will be controlled and run by private interests.
Well, I mean, within your film that you made, there's another video that explains how perverse the whole system is. If we look at this one of about the administrators.
Over the last 40 years, the number of doctors in the American health system has doubled. However, over the same period of time, the number of administrators has increased exponentially by a staggering 30-fold.
That is just phenomenal, and that sounds like the model that we have when everyone's talking about the management side of the NHS growing incredibly, and the clinical side being diminished. It's exactly the same, isn't it?
Yeah, in order for this dystopian system to work, you need a lot of administrators. You need people to set the charges, to break up medical care into separate entities for which you can charge. You need somebody to chase the billing. You need people to set the insurance premiums. You need people to assess individual risk. And then you need marketing and advertising for these insurance companies to compete for customers. And then you have lawyers and justice systems trying to, first of all, get payment, challenge fraudulent payments, and spend lots of money and resource fighting claims, either denying claims or trying to get money that hasn't been rightly earned. So this is a huge job creation scheme for pen pushers, but in particular, the complexity of it all adds a huge overhead. And remember, all of this is unnecessary because we did have a beautifully simple system for which you didn't need a separate administrative layer. It's called general taxation. And there wasn't this overhead. So the estimates were, before we went down this road, pre-Thatcher, the overhead for the NHS, the purely administrative side, was less than 5%. Estimates in the mid-2000s was it had risen to 20%. The American system we're copying, the overhead administration is 36%. So $1 in every $3 is just being leached away just in running the system.
Wow, that is unbelievable. And you sort of in your film as well, you've actually got a slide about the way that the US system's already creeping into this country.
The American health insurers are already here. Since 2003, United Health Group, and through its subsidiary Optum, has been awarded NHS contracts across England to provide prescribing decision support software, management of GP referrals to hospitals, and crucially, to implement policy to redesign the NHS. United Health Optum is ideally positioned to capture control of NHS budgets allocated to GPs via their registered patient lists.
Wow! So it's already they're all there. It's already here.
Yeah. So United Health are America's biggest insurer. They had their former head of global expansion, chief executive of NHS England, Simon Stevens, for 7 years. Prior to that, United Health were already involved under the Blair Brown administration, creeping into the NHS backroom office function. As that graphic demonstrates, they've been awarded contracts across the country. More recently, within the last year, United Health have bought up the GP patient data system called EMIS. They bought up another platform called 14 Fish, which is responsible for the training of GPs and other health professionals. So they've grabbed hold of the data. They've put in their own software. They have their personnel training NHS managers. And, the system we have now of integrated care systems or American managed care is designed for and by the insurers. And these 42 ICSs, which are new public-private partnerships, they are paid out what is called capitation payment, a fixed sum per head of population. And the insurers, their business model is to make money by using this fixed pot of money and denying care to the sick. That is the business model. So they provide less care and the more money they make.
Wow. No, I mean, I think this is really important that people find out what this private health insurance is all about, because it's often spoken about as the alternative, but it really is not an alternative because it doesn't care about the patient. And even sort of KCs, these very well-off people can't even afford private healthcare. So how is anyone else going to get by on it? It's a terrible alternative. What would you say people have to do now? Just what's your view on what we should do?
Well, I think raising public awareness, see through the media and politicians' lies that somehow shifting to an insurance-based system is a good idea. They keep constantly nudging us about introducing user charges, pay to see your GP, pay to go to use 111. The whole reason for introducing user charges is then you've got a choice. Either you pay out of pocket or you take out an insurance policy. So the nudging is all towards promoting insurance. And, you know, they're using the preventable harm, the long waiting lists to nudge people into the false reassurance that insurance will fill the gap. But as you've seen with that example, they cover you if you're straightforward and simple and cheap. Soon as you become desperately ill and expensive, they will dump you like a hot potato. So we have to avoid, we can reverse, we need to call for renationalization. We need to get the health unions on board with this and get them, you know, stop colluding with the demise of the NHS.